At the 2025 American Association for Cancer Research annual meeting in Chicago, a surprising breakthrough came from an unexpected source, calcium. Researchers from the University of Arkansas and the Moffitt Cancer Center presented compelling preclinical data on anti-orbital ionic calcium, AIC, an emerging calcium-based therapeutic approach originally studied for bone regeneration. Their findings revealed that AIC not only helps rebuild bone, but may also play a significant role in preventing the progression of multiple myeloma, a cancer that thrives in the bone marrow environment. In animal models, over 60% of mice pre-treated with AIC survived beyond the study period, while all untreated mice succumbed within 39 days. Imaging confirmed slower tumor growth and significantly improved bone density in the AIC-treated group. Unlike therapies that directly attack cancer cells, AIC works by reprogramming the bone microenvironment, making it less hospitable for cancer to grow or return. This shift in strategy from targeting the tumor to fortifying the host tissue offers a promising new angle in the management of remission relapse. Importantly, AIC is not a replacement for standard cancer treatments. It is being studied as a complementary and supportive therapy that can be safely combined with conventional treatments to improve outcomes and enhance patient quality of life. With its emerging safety profile and unique mechanism of action, AIC is now gaining recognition as a potential early-stage addition to myeloma care. As research advances, AIC may help pave the way for more integrated and patient-centered strategies in oncology, ones that not only fight cancer but also support the body's ability to resist and recover.